We want to start off with a reminder that we are not doctors. Before you make any changes or try something new, always consult with your doctor and medical team first. Chronic illness can vary from patient to patient, so it's always best to consult with your own doctor for what is best for you.
Hello and welcome to IBD Determined. I'm your host, Mason Harvey, and I speak from the role of a patient and I have Crohn's disease.
And I'm your other host, Michelle Harvey. I am Mason's mom, and I speak in the role of a caregiver. And today we're going to talk about something that we are learning more about. And I think it's important to talk about. I think some people don't like talking about using AI in a lot of things. So I think that AI is here and people are using it. I do think it's important to talk about because I had heard, and I told Mason about this, some of the IBD groups that I'm a part of, they were talking how they use ChatGPT to diagnose things. And I was like, is this for real? Like,
there's no way ChatGPT can do that, right?
And because I didn't know enough about it, because honestly, I don't use it.
I've never used it before.
Yeah.
So.
I ended up creating an account through it to see if I could ask it my own questions and, see what happens. Because upon researching it, some people will enter like lab results. They'll enter images and ask ChatGPT to diagnose them or symptoms. And there's, I don't know if some cases are real or not, where people say like it diagnosed them before.
You can tell they're just trying to
we don't
talk it or,
we don't know.
You don't really know. But.
No. But the important thing is so I thought, let's do our own research today and look at ChatGPT and see what it knows about IBD. At the same time, it was also kind of interesting to research some popular questions that get asked, and maybe your questions will be answered in this episode too. The idea is we're going to ask ChatGPT questions that have been determined by doctors to be some of the top questions asked. And then we're also going to ask a few questions that ChatGPT says are the top 5 most asked questions about Crohn's disease.
Okay.
So it's interesting. So first of all, really quick, for some of you listening, some of you are pros and you're like, oh, I've been using it to modify pictures, to, roast my Instagram.
Yeah, we need one to roast our YouTube. Oh, no, don't do that.
No, I can't handle that. It's rough.
That thing is insane.
Yeah. So I've seen these things. And so some of you are going to know about this, and others are like, what is a ChatGPT? What are we talking about here? I didn't ask ChatGPT. I didn't ask it what it was, but I did go to Google because I thought, let's just use Google. And I asked it, what it is. And so for those of you out there that don't know, it's a conversational AI chatbot. It was developed by OpenAI. It's built on the GPT, which is a generative pre-trained transformer platform. So it's an architecture that excels at generating human-like text in response to user prompts. Basically, ask it a question and it's going to respond. And usually it's very polite.
It is very but it's very polite to gentle. Yeah. It's actually nicer than most people.
Right. Yeah. If you ask someone a question, they're like, and this one's like, oh, let me look that up for you.
Excuse me, sir, but yes, puts on tuxedo.
Polite. It's kind of interesting to see like what its capabilities are. I also thought, okay, where is ChatGPT getting its information from? How, like, when I ask it a question, how is it so fast? How does it from? Where's it getting from? I asked, and it says it gets its information from a massive training data set composed of text from various sources, including the internet, which are books, articles, websites, things like that, and other data which has been provided by human trainers and researchers. So the thing it answers here, it says, and I'm, this is stuff we're pulling up and reading to you guys. You can find this online too. It doesn't actively surf the web in real time. So instead, it says it relies on patterns it's learned during its training to generate responses.
Interesting.
So I thought, because I'm like, wow, it's so fast. It's like Google,
faster than Google almost sometimes.
Because I'm like, this is amazing. It's like, I can ask it something and it's like, boom. And it's like, we'll discuss as we go along because it is very interesting what it does. That's how it's responding to you. So it's not like surfing the web at the moment to find this.
It has all just
basically,
memory.
yeah, it's already relying on these patterns. It says
And
that it's
unlike a
learned.
human, where a human's looking for which file did I put that in, the AI just knows exactly where it is and just pulls it.
It's really very interesting
It
because
is.
it can predict also based on your question what your next question is going to be. And so you can tell that it does have these patterns that it has already learned. So it knows like what you're going to ask next, which is really
That's
it's
crazy.
wild. So
Yeah.
have fun. You guys try it out. Go to ChatGPT, get an account. The other thing is I want to be clear like today when we talk about this, nothing we're discussing today, this is all based on what we found on ChatGPT, Google. This is not from a medical source like a doctor. And so again, not to rely on these
Yeah.
findings
You need to ask your doctor
solely.
first.
Yeah, so that's the important part. Like maybe if you want to search something, you have a question, great. Make sure
You
that
always
you're,
consult with your doctor.
yes, you're still talking to your doctor. That
If
is
AI tells
key.
you to come off your treatment,
Right.
don't
Because
trust it.
yeah, because again,
Oh.
it's been trained, but who's trained it
Yeah,
and
who's
where
trained
has it
it?
got
Yeah.
this information from? It's interesting. Anyways, I could go on and on about
It's
ChatGPT
very
because we were
interesting.
having like lots of good
Yeah,
conversations
it was
about
very
it.
funny too.
So one of the things I asked ChatGPT before we got started, I asked it, are you reliable for medical information? I want to see what it
Yeah, what
thinks.
does it say?
And so it's
No.
I know.
It's just like,
No,
no, I'm
it's
not.
nothing.
No, don't go off of me.
Time's out
I
here.
have these pollen information. I don't know what I'm doing. I got it from the Wikipedia.
Yeah, no.
No, the AI, ChatGPT doesn't do that.
Yeah, I asked it that question. And it was like, well, it said that it provides general evidence based explanations on many medical topics based on extensive training data to 2023. So that's what's interesting. So I had kind of tested this theory by asking some other things about biosimilars and biologics. It seems like it's more, I don't know if that's just, I don't know why I got that answer, but I feel like it's more recent, the information I
Yeah.
have that I got answers to. So, anyways,
I feel like
um,
that answer is kind of saying,
see, messing up. It's already,
I feel like no, I feel like what it's doing is it protecting itself because it's not saying yes and it's not saying
right.
no.
No,
It's saying if you
it's
want to, you can.
right. It's not, yeah, it's
There's no other insight.
it also says that it summarizes medical concept, guidelines, and research trends in an understandable way. Absolutely. So that's the
Yes.
other thing. It can maybe if you have something that you have like results, you don't understand what it means. I know people use this almost like to interpret it and
Mhm.
tell them in a simple way for us
What
to
does this
understand
mean?
what this means. So I have heard of that. I do
That
know people
way,
do
that's
that.
also nice to use AI. You don't have to go to your doctor going, how do I know what this
Yeah.
means? Your doctor can't help you, but you can also ask AI.
It also said that it helps with patient education, question preparation for doctors, and basic health literacy. So I really actually liked that one,
Mm-hmm.
the question preparation for doctors, because you know how you're always supposed to go in and they're like, make sure you
Yeah,
have
you have
something, a question.
and it's like,
And so Mason's like, but you know what? It's important to think about because usually when you get to your doctors, usually the time flies and you
mhm.
forget, and later on you're like, oh, I wish I'd asked this.
Yeah,
So
which I ask. It's like when you go to the store and you're like,
yeah,
what was I supposed to
you
get?
get home, you're like, oh,
And you
I
get home, you're
forgot
like,
that. So
got the milk.
that's pretty cool with this is that it may prompt you to ask questions you otherwise had not thought to
Mhm.
ask. And so that's kind of cool.
Yeah.
It also says it can point to common treatment options, risks, and disease mechanisms reliably. So that's what it's
Exactly.
saying.
Okay.
ChatGPT, gives itself a pat on the back and says it's going to do a good job for you, but it's not going to replace a doctor.
Okay.
That's not what we're here to discuss today, anyways. But doctors out there,
Don't worry, doctors. You're still in business.
yes, no, for
We do
sure.
not want doctors to go.
For sure. So this is again not to replace that, but a lot of people
What if
are using this.
ChatGPT one day decides to troll you? No, it wouldn't do that.
No,
Right.
no, we don't
Yeah,
know.
we don't know.
Here's so to start it off, this is gonna be like two segments, like two parts here, not two segments. This is all in one thing today, but we broke it down into two parts here. So we asked ChatGPT, what are the top 5 most asked questions about Crohn's disease? And I apologize for ulcerative colitis friends out there listening.
Mhm.
I want to do IBD, but our other questions in the second set are related to IBD in general. So the reason I just went with Crohn's disease is because it can sometimes be a little more complex than ulcerative colitis, and so I wanted to see what it said about Crohn's disease. So not trying to
Yeah.
ignore you guys are just as important, but I wanted to see what ChatGPT would do.
It's not just a precise thing. No, it's not just like a wide thing that can do. It has to be more precise with it. So
So we want to see.
yeah.
The first question is you want to
The first question is that ChatGPT is asked a lot is what is Crohn's disease and how is it different from ulcerative colitis?
And I can see that most people associate those two together. We did this in two ways. We had ChatGPT
Yeah.
answer this. Then I went to Google
The
and I
Google
Googled the
AI.
exact
Mhm.
same question. And you know how like Mason just said, Google AI. So you know how like when you Google things, there's something at the
It's like the
top
top thing.
and it like summarizes and then it puts websites next to it so you
Mhm.
can reference where
You
they
can see
got it
the
from.
information where they got it from. And
Right.
sometimes thankfully, when it shows you the websites, the Wikipedia pops up and you're like,
Yeah, so Google is this is a little
yeah,
different
it's
than
a
how
different, yeah,
ChatGPT is, but I wanted to put the two answers together to see,
to compare.
just to compare. The answer, what is Crohn's disease and how is it different from ulcerative colitis? Do you want to read the answer?
I'll read ChatGPT and you can read Google
Okay.
AI.
And I may interrupt you or you can stop if you want to talk about something as we're reading it,
All right.
but otherwise we'll let you just go.
All right. Hopefully YouTube doesn't take this part TMI out.
Yeah,
All
sometimes
right.
yeah.
ChatGPT's graphic, okay?
It's accurate.
Okay. Yeah,
It's
it's accurate
accurate.
and it's graphic.
Which is important because if it wasn't, that'd be kind of weird.
Yeah, it'd be bad if it wasn't.
Maybe you could ask this a question and say, how would you explain this to a child?
Yeah, how would you tell this to a child?
That's how you could
Explain
question. So if
that.
you want a more,
Yeah, if you want a more
children's
chill,
book
yeah,
friendly
not
answer.
TMI,
Yeah.
yeah.
So, all right. So
All
let's
right,
see.
so yeah, if you don't want to hear this, close your ears.
Are you
Close your
regretting
ears.
picking
Yeah,
ChatGPT?
well, I'm still seeing it in Google AI, so
Okay. Yeah,
that's fine.
you're not getting away from it either way. Go ahead.
So it says Crohn's disease is a chronic immune-mediated inflammatory bowel disease, IBD, obviously it has that can affect any part of the digestive tract from mouth to anus. This is
Yeah.
why you should ask for a children's answer.
Yeah.
Often in patchy areas. It causes inflammation that can extend through the entire thickness of the bowel wall. Yeah, we need a definition.
Hmm.
In contrast, ulcerative colitis only affects the colon and rectum and involves continuous areas of inflammation and is typically limited to the inner lining of the bowel.
I think that's pretty
Yeah,
accurate.
definitely.
Obviously, and again, these go further. We're just taking
Yeah,
like
we're
the
just taking the
summaries,
first,
like
yeah,
the
the summer.
parts,
Yeah.
because what it'll do, it'll give you this answer, and then it'll say, let's give
Let's
you
break it
more.
apart.
Yeah.
And then it gives you an entire essay.
Right.
It's
So
like,
we'll break this down more. We don't have time to do
yeah.
all that we want to do. Just
I mean, unless you guys want to
can do it
listen
yourself.
to us for 5 hours.
No, they don't. So you guys, you go right
Yeah.
ahead, and you can do this yourself.
Yeah, you can
And
do yourself. Download. Is ChatGPT free?
yeah,
Okay, yeah, download
I mean, there
ChatGPT.
might be features that aren't, but the one I use is free.
Yeah, well, I mean, with the one
So
we have right now and it's free is good enough, you
yeah,
know?
no, we're not, yeah, because we're not avid users of it yet. But it's again important to learn, important to know how things work, and in any rate, even if you like it or not. So we asked the same question to Google: What is Crohn's disease, and how is it different from ulcerative
Let's
colitis?
see how it compares.
Their AI came up with AI. So let's see. Oh, Crohn's disease and ulcerative colitis are both inflammatory bowel diseases, IBD, that cause chronic inflammation of the digestive tract, but they differ in location and extent of inflammation. Crohn's disease can affect any part of the GI tract from the mouth to the anus, while ulcerative colitis is limited to the colon and rectum. Additionally, Crohn's disease can involve inflammation throughout multiple layers of the bowel wall, while ulcerative colitis typically affects only the innermost lining. That actually, I mean, it went a little bit more into detail, but again, pretty similar.
Yeah.
And the thing with the Google AI is next to it. With Google, the thing that they have is they're going to have websites next to it. So you can research this further, you can get more information. And they also do what ChatGPT does, where they break it down further.
Does ChatGPT give you the what they took it from?
You know, they may have links on there, but I didn't notice that. I didn't see that.
So I mean,
one like with Google, you have to start pulling apart the information more to read more about it. ChatGPT will
does
just
it
keep
for
feeding
you?
it like yeah, it kind of does that for you. So that was interesting. The next question that is most often asked is what causes Crohn's disease? Okay, yeah.
Okay.
Obviously, this is asked all
I'm surprised
the
that's
time.
not the first one actually.
Yeah, that's
but I'm seeing the third one and I'm like, oh no.
right.
No.
The answer, I'll let you go for ChatGPT. What ChatGPT say?
So ChatGPT gives us like bullet points. So it goes, the exact cause isn't fully known, but is believed to result from a combination of bullet point. Is believed to result from a combination of genetic susceptibility, immune system dysfunction, which is overreacting to normal gut bacteria, environmental factors like smoking, diet, and gut microbiome changes. It is not caused by poor diet, stress or poor diet, though those can influence symptoms. That's interesting.
So what they're saying, which I appreciate here, first saying it's not fully known. So they're admitting right now that
They're
it isn't,
that
which is accurate. That's what we've learned. The combinations, the things it mentions, the genetic susceptibility, immune system dysfunction, environmental factors, those are all things we've also heard. We've heard other things. And then I do like how it says it's not caused by stress or poor diet. Thank you,
Yes, because
ChatGPT.
a lot of people are like, oh no, I caused this. It's like,
Right.
no.
And so I think that's important. And now, like they said, it can influence the symptoms, but it's not like, oh, you gave yourself IBD,
Hmm.
you
Yeah.
stressed too much, and you,
So yeah, thank you for adding that little side
right. And
note.
the diet. And so I think that
Yeah.
was really
It's very good.
important. So I liked that. After we got that response, we went to Google AI. We asked that question, and it said the exact cause of Crohn's disease is unknown, but it's
Okay.
believed to be a combination of genetic predisposition, immune system dysfunction,
Okay.
and environmental factors that trigger inflammation in the gastrointestinal tract. While diet and stress can worsen symptoms, they don't directly cause the disease.
All right.
So clearly, this has pulled from the same
So the
information, which this is like kind of the basic information that's out there, right?
Yeah. So what I'm noticing that ChatGPT did better is it is not caused by stress or poor diet, but has it in a more like a bullet point thing, which
Yeah,
I like
and
better.
they describe
Yeah,
what
and
immune system
also
dysfunction.
yeah, they describe what it means by immune system dysfunction, what it means by environmental factors, because
Right.
Google AI got that, and good job to Google AI. But we have like smoking, diet, and gut microbiome changes, overreacting to normal gut, so it gives you details,
And now
which is helpful.
there'll be more details when you look these up that I didn't include here. So
Hmm.
it goes
So
more
same.
into that, but these are the quick summaries that you read, and so it shows you again
Yes.
just how they compare with each other. And so I think those are both
Good.
good. The third question, can Crohn's disease be cured? I can see
Yes.
why this is another big question because these are all the things you were asking right away, right?
Yeah. Can
You're-
Crohn's disease be cured? And he's like,
yeah.
sadly, no. All right.
So,
So what does ChatGPT say? No, there is no definitive cure yet. All right, that's good.
mhm.
And it says, however, treatments including biologics, immunosuppressants, and surgery can manage the disease, induce remission, and improve quality of life. All right.
Mhm.
Ongoing research into microbiome therapies, new biologics, and precision medicine continues to advance potential long-term solutions.
So it nailed the precision medicine one
That's
too.
good.
It included
That's good.
that. So I feel like
Like
that's
that.
an excellent quick answer for somebody who wants to know more about this disease. And I like how right up front, no,
Yeah.
there's no definitive cure
You just
yet.
break the news there.
So I really like how it broke it down. I think that was a
Hmm.
great and accurate. To me, it seemed accurate with what we've learned.
I like that.
Google AI said no.
No.
Crohn's disease is a chronic condition that cannot be cured. However, it can be managed with treatments that help to control symptoms, reduce inflammation, and improve quality of life. They go on to say, like, I took it a little bit further with Google AI just because it was right underneath it. Medications such as corticosteroids, immunosuppressants, and biologics can help to suppress the immune system and reduce inflammation. Surgery may also be necessary in some cases to remove affected portions of the digestive tract. Breaks it down a little bit more. It also mentions again there's no cure for the disease. Treatment can significantly improve the lives of patients and help them achieve long-term remission. Research is ongoing to develop new and more effective treatments.
I
Both
mean,
of them,
both of them, actually, Google was almost more descriptive,
yeah.
but Google AI had a more shorter answer.
Or ChatGPT.
ChatGPT, my bad. ChatGPT had a shorter answer. However, what they did is they described that there's ongoing research into microbiome therapies, new biologics, and precision medicine.
Yeah.
And so Google AI didn't do that, but it is a longer and more, it explains a little bit more. And
Right.
so they're both really good. I think they both have their
And honestly,
pros and cons.
I think there could have been more with that I just didn't include from
Yeah,
ChatGPT.
there probably is.
But I think when you compare the answers, I'm going, this is cool. And then if you're on Google, you can go to if you're trying to write a paper or if you're trying to do more research, then you can go to the website that it connects you to. You can ask these things. You can try to ask it, say, where did you find this information from? And it should be able to let you know.
Google
So, yeah.
AI can get you the sources, and ChatGPT can get you the sources and write your paper.
Right. Yeah. Which don't
Do that.
do
That's
not
bad
do
because
that.
that also would probably include
Because they check too, like for plagiarism
but
and
it
things.
will also have
Oh,
plagiarism because it's taking from sources
right.
and it's not really writing on it. Well, I mean, it is writing on its own,
You don't,
but
yeah.
it's not
But you're
like
not learning what you're supposed to
no,
be
you're not
learning,
learning
which
what you're
is,
supposed to be
yeah.
learning. Which
So,
why are you taking the class in the first place
right.
if you're not learning?
But if you're using just for the heck of it, like just for fun or to write something on Facebook or Instagram, you want to be creative, go for it. That's again, this is your choice. I'm really into for our podcasts, we're not going to be relying on ChatGPT or anything AI to write these. These are
These are all by us.
all by us. I think that's important to have that human element too. We're not going to be doing that, but if you guys want to use it how you will.
Yeah.
Yeah. So let's jump to number 4.
I'm scared for this one because
What are the symptoms?
I'm
Do you want me to read it?
no, I can read it, but YouTube might take down this video. So
So, what are the symptoms of Crohn's disease? I'm going
right.
to see how accurate these get. And I understand, I wanted to just,
TMI warning
yeah,
again.
I was like, well, how
Yeah.
far are they going to take it? And so let's see. So you let us know. What did ChatGPT say, Mason?
So ChatGPT says symptoms vary depending on which part of the GI tract is affected. All right, but common ones include abdominal pain and cramping, TMI, chronic diarrhea,
Oh,
sometimes with
no.
blood and mucus. All right.
Sorry.
We're kind of out of the TMI thing. We're
I guess we're just,
weight
yeah,
loss and fatigue, fever, anemia, mouth sores, joint pain, and skin issues. So yeah, and it
this
says
is.
symptoms often come in flares and remissions. So yeah, it's pretty accurate.
I mean, I think it got a lot of them. It was pretty good at mentioning all of them. And
Yeah,
it does go into more detail, but again, this was
that
the
was just
quick,
short.
like the summary, and I was
Yeah.
like, wow,
And like
it nailed it.
it said it often comes during remissions, which in flares and remissions, but mostly, but it names flares first,
Right.
so it's
Because
kind of helpful.
Mason has been in remission, but Mason's also had these
Yeah.
symptoms come in while he's in remission,
Hmm.
which means you're heading towards a flare
Yeah.
potentially.
So
So
technically, it does come during
I
remission,
think
but
that's important to actually mention
yeah.
because some people think remission means perfection. And it's like
Mm-mm.
it's not like linear. It doesn't always look
Mm.
like that. Google AI, they said Crohn's disease symptoms can vary, but common ones include abdominal pain and cramping,
TMI.
diarrhea, fatigue, and weight loss. Other potential symptoms include
Oh,
fever,
TMI.
bloody stool, mouth sores, and skin problems. Or symptoms can also include joint pain, eye redness or pain, and nausea or loss of appetite. What Google got that ChatGPT didn't was the
Eye
eye.
redness. Hmm.
And
I mean, maybe ChatGPT had that later.
they
Didn't
might
get that,
have,
but
but in the
yeah.
in the right in the beginning, right when so that was the only thing
So
really lacking. Also the nausea and loss of appetite. The other one says, weight loss and fatigue, but loss of appetite to me is a little separate. It's not quite the same. So on
yeah.
this one, Google pulled a few more symptoms. Both are accurate with what
Yes,
they
both are
had. Google went a little bit more into detail a little more quickly.
And
So
then, you know, how ChatGPT, so these are just the summaries, but,
yeah,
you know, these are still pretty good.
right. Because again, they can take this further. This is
Yeah.
not like this isn't
These are
it,
not just it.
but
There's
we're
definitely
trying.
more.
Yeah. Number five, what can I eat with Crohn's disease? I see this all the time.
Mm-hmm.
And people are like, what is safe to eat? And so you know our answer to this because we talk about this a lot on the show. But
Yes.
this was a big one to me because I'm like, okay, this right here is going to indicate a few things for me. So I want to see.
Mhm.
So we're reading these like in real time with you guys because we copied and pasted and we have them up here. But we wanted to have real reactions. So let's
Yes.
let's find out. So what does ChatGPT say,
So I
Mason?
like ChatGPT's wording here. It says, there is no one size fits all Crohn's diet. All right,
Mhm.
that's good. Many people find
Right.
symptom relief by avoiding high. So, by the way, suggesting that you might not, but many people find symptom relief. So, it's suggesting that you might too.
And this
By
is actually
avoiding.
what our dietitian
Yeah, this is
recommended
what our
too.
dietitian recommends. Your
IBD. Mhm.
dietitian is using ChatGPT. No, just kidding.
I mean,
Well, you
we
never
don't know.
know. All right.
No.
So it says many people find symptom relief by avoiding high fat, fried, and processed foods, raw veggies, nuts, and seeds during flares,
Accurate.
mhm, dairy if lactose intolerant,
Hmm.
alcohol and caffeine if they worsen symptoms,
Yep.
which I can't have caffeine, and I certainly can't have alcohol.
I know. Right. Right.
And then popular approaches include low residue diet during flares,
Hmm.
Crohn's disease exclusion
The
diet,
CDED.
CDED,
Yeah.
specific carbohydrate diet, SCD,
Which is very popular.
mhm, and Mediterranean style eating, which I hear all the time when we're at IBD day.
Right. So all these are familiar, right? Means like I've seen these on the big screen at IBD day. The
Yes.
dietitian always mentions these. So
It finishes up its little summary with food diaries and individualized nutrition plans are key.
and so
All right.
interesting, what I didn't include here, the part that I did read that was underneath this, it asked us, it was like, would you like me to create a meal plan, or
Oh, that's
and help you
cool.
guys plan? So ChatGPT was
Is it
like
offering to help you?
offering to help figure out what your trigger
That's a
foods
good
are.
AI.
I was like, wow. So I didn't click
Mhm.
it but I have saved it. It's on there because
That's
I
cool.
just
I
want to see what
think,
it
yeah.
says. So it did take this further actually to offer to help guide somebody, and I thought that was interesting. Also dangerous. just to note, following the advice of ChatGPT for a dietitian or for diet, uh, again, these are things that you should bring up to your doctor
So
or
what you
your,
should do is ask AI and then present it to
yes,
your
and see
doctor.
what your doctor thinks. I thought it was interesting that was offering to help, which I was like, oh,
That's
cool.
cool.
And I was like, oh, I
And the same
hope
time, it's like,
enough
oh,
people realize
you need
like
to talk to
you
your
should
doctor as
still
well.
consult with this. Yeah, but it
You
was
know,
interesting.
there's people are gonna be like, I don't need a doctor. I have
I know.
ChatGPT, and
Well,
it's like,
that's kind of why we're discussing this today because I do think it's a lot of things are heading in that direction where people think that it's so smart, AI is so smart that it can replace humans in a lot of ways. And so I think this is an important reminder that it can enhance our experiences, it can answer questions, it can
mhm.
give us good questions to ask, but it's not going to replace
No,
your doctor. So I think that's just one of the reasons why we're doing this today
yes,
too.
yes.
So we asked Google AI, of course, the same question, and they said when managing Crohn's disease, a balanced diet with easily digestible foods is key. Kind of weird, because
It's not suggested because it didn't. So what at
like the
first?
other one, ChatGPT came right off and said it's
Yeah,
not a
no
one
one
size
size fits
fits
all.
all.
So ChatGPT is telling you that it's different for everyone. Yours is not going to be the same,
Right.
and
But
AI is
the Google AI is like saying when managing Crohn's disease, a balanced diet with easily digestible foods is key. So I think though that
yeah,
is
it's
key
still
for
yeah,
anybody.
it's key for anyone.
This is common.
Hmm.
So I don't know that this is necessarily something just with that is with Crohn's disease specific. Anybody should eat like that, to avoid issues. Then they say during flare-ups, focus on soft bland foods like white rice, bananas, applesauce, and cooked vegetables,
Okay.
which is interesting because like
Hmm.
vegetables for you was
Yeah.
not on the menu at first when you were in a
Yeah.
flare because this is not going to take in your individual symptoms because again, TMI, I'll try to say as nicely as possible, but with this disease, you can have two opposites. Someone can be in the bathroom every, 30
15
minutes,
minutes.
15 minutes, and other people have the opposite issue where they don't go for days. I think that
Once again, no
this is
diet
where,
fits one
yeah, this is where
fits
diet
three.
is so important to discuss with a professional because your symptoms are going
Are
to be so
different.
individual and different. And so you want to be careful. We had that's how with Mason, we had a very specific suggestions based on him, based on
Hmm.
his symptoms and based on his labs, everything is very important. So anyways, just want to remind you what I'm saying. They also recommend lean proteins such as fish, chicken, and tofu, as well as low fiber fruits and refined grains.
All
They're
right.
also good choices. Foods that may trigger symptoms like high fiber foods, fatty or fried foods, and spicy items should be avoided or limited.
All
I
right.
mean, that's generally recommended. And again, everyone's different. Mason can eat like chicken
Anything.
fingers, chicken tenders anytime. And
Yeah.
he's like, it's no
I'm good.
problem.
Yeah. Now, if I'm going into a flare, that's when we try to,
But there was a
that's
time
fine.
when you're in the flare. I remember your doctor,
Mm-hmm.
because I was like, he, does okay when he eats the chicken tenders. She's like, that's okay. That's
Mm-hmm.
him. And if he's doing okay with that, then the important thing is they need you to eat. And
Mm-hmm.
so it's better to find something you can eat and not instead of saying, well, just avoid that. If he's doing okay, he's doing
Yeah.
okay. But anyways, I just thought that was interesting. So the cool thing about ChatGPT, we're going to go to the next section here before I go, is it does make further suggestions, which is really interesting because sometimes as you're reading these things, you're like, oh, I wonder what this is. And when you get to the end, it's like, would you like to know more about blah, blah, blah? And you're like,
Sure.
yeah, how did it know? It's pretty cool for those reasons. We have a few more questions we're going to go through, so you can break this up. You can listen to this in two sections if you want to. And so I had found an article, which I can put the link in here for, so I'll make sure to include that. But it was an article in the National Institute of Health, and it had showed the 10 questions GI doctors get asked the most. And they asked GPT, they were trying to compare the responses to doctors. So we're not going to be going into that article.
No.
We can save that for another time. But I just took 5 of the questions that were different than the top ones that ChatGPT came up with, but
Mhm.
these are ones GI doctors came up with. And I just picked 5 out of the 10. We
Okay.
didn't need 10 questions. We already covered
No.
a lot.
We're covering 10 right now.
Yeah. One of the questions they get asked a lot is there a definitive cure for IBD? And so this is kind of similar to what we already talked about, but this is for IBD, not just Crohn's disease specific, which is what the other questions were. I'll let you read. Let's see here. I mean, we basically kind of covered this, but we covered Crohn's. So let's see what it says for IBD in general.
So it says, is there a definitive cure for IBD? It says, no, there is currently no definitive cure for inflammatory bowel disease, IBD, which includes Crohn's disease and ulcerative colitis. These are chronic immune-mediated disease conditions where the body's immune system mistakenly attacks part of the digestive tract, leading to inflammation. That's good.
So it's good,
Yeah.
right? I think that is accurate. And
Hmm.
Google AI said No, there's currently no definitive cure for inflammatory bowel disease. However, various treatments can effectively manage symptoms,
Okay.
induce and maintain remission, and improve the quality of life for individuals with IBD. So I like ChatGPT's answer a
Yeah.
little better, but both were accurate.
Yeah. I
Neither one was wrong. So yeah,
I like how the Google AI one said there are various treatments. So it's telling you that there's treatments to treat
yes,
it, which ChatGPT didn't do.
right,
However, ChatGPT sacrificed the space where it had where the treatments, where it had a more explanation on how it works.
right,
Because ChatGPT talks about how the immune system mistakenly attacks part of the digestive tract, which is very cool because now it's telling you how it works,
right.
which, it probably goes into the treatments lower in the summary part. I mean, out of the summary part, but
Mm-hmm.
I like ChatGPT's a little
Yeah,
more.
I know.
It's hard to say
Again,
though. They're still pretty
both
cool.
are good.
Because at the same
Um,
time, we have to remember that ChatGPT is like meant for this, right? ChatGPT is solely based on AI, while Google AI is also AI, but it's part of Google itself, where
yeah,
you pull up websites. It's not exactly only meant for AI. It's
right,
more of a tool that does everything.
right.
So it's still pretty good. I prefer ChatGPT a little bit more, but they're still pretty good.
And a lot of times, like, I'm still going to revert to Google first because I like
Yeah.
to get the articles because I like
Yeah.
to
No, yes,
read.
if you want articles, yeah,
Yeah.
if you want the AI
And
thing from
again, I could probably
ChatGPT,
ask ChatGPT, which I'm going to try. I want to ask it
okay.
for the articles or where it got where the source was, because I like to read the articles myself and make sure that see what I'm reading, see if there's any bias with the article. I think it's important for us to analyze and read articles ourselves too, and not just rely on the summaries from these things. It's important to do your own research and to better understand it. So that's me. Some of us are just looking for a quick answer, and
Yeah.
this will help you.
They're just really good.
The other question is, what should I eat to manage my IBD well? And so, again, the other things we'd ask were related to Crohn's. So, this is related to IBD,
IBD.
which is Crohn's and ulcerative colitis. Here, so it's going to be slightly different. So, let's hear.
And so ChatGPT starts with congratulating you on asking this question. It goes, excellent question.
I know
Thank
it's
you,
so
ChatGPT. That's
positive.
so nice of you.
I love it.
Yes, give him a hug. It says, excellent question. And one that's often frustrating since there's no one size fits all IBD diet. All right, here we go again.
Hmm.
But I'll give you a clear, evidence based breakdown of what tends to work best for managing IBD based on clinical guidelines and patient experience. Keep a detailed food symptom journal for 2 to 4 weeks. Track what foods worsen or calm your symptoms. What works for one person with Crohn's or UC might not work for another. So,
So again, they mention that's not a one size fits all approach.
mhm,
And I like that they say they're going to give you evidence-based breakdown for what tends
yes,
to
I
work
like
best.
that. Give
And
evidence based.
yeah,
Yeah,
but
that's
then
good.
it says like in bold, managing IBD,
Hmm.
not curing, not, it's just managing,
Managing. It's
So,
like putting a band-aid on something. It's
mhm.
not going to make it better. Well, I mean, it is going to make it better, but it's
Right.
not going to cure it instantly.
Right. So it's
Yeah,
again, interesting stuff. And
very interesting. Do you like it's a human? It's like,
yeah,
excellent.
like
I'll
they're just having a
explain to you.
conversation. And there was more
I'll tell
information
you.
it went into again, which was really helpful. It was like, wow, this is
Yeah.
like it cares, like it's really like, yeah, I do care about how you're feeling. Let me help you out. And so I can see where some people who might be feeling kind of alone or feeling unheard,
Hmm.
you ask these questions and you feel like, wow,
Oh,
it's
it's listening
listening.
to me. It feels like a real person. I feel
It's
like that's
it is
comforting.
very interesting,
Yeah.
yeah. And Google AI says a balanced diet with focus on anti-inflammatory foods is generally recommended for managing IBD.
Okay.
This includes fruits, vegetables, lean proteins, and healthy fats. During flares, some adjustments may be necessary, such as cutting out potential triggers
All
and
right.
focusing on easily digestible foods. By focusing on a balanced anti-inflammatory diet, staying hydrated, that's important,
Okay.
and making adjustments based on your individual needs, you can effectively manage your IBD and improve your quality of life.
Okay.
Okay, so what I liked, it seemed to change its answer when we asked it this versus Crohn's,
Yes.
because it makes more effort to say it's based on individual needs. It mentions a differentiation between flares
Hmm.
and what you should the only thing that I kind of didn't like was when it says you can effectively manage your IBD.
Effectively.
It
Like,
should say in combination with treatment,
yeah.
because I
Because,
feel like somebody reading this, the only reason I'm being that picky, and this is being picky,
yeah.
but sometimes I try to read things like as a desperate, like,
Parent, yeah, like
parent who's
like
like,
picture yourself as a parent. Your kid just got hospitalized and it has Crohn's disease, or you just got hospitalized and have Crohn's
and
disease.
they
You go,
hate injections.
yeah,
They
you
hate,
hate injections. You go, oh my God, search Google, and Google
yeah,
says
what
you
can they
can
do?
treat it effectively by just being on a diet, and you're
Right.
like, oh, thank God, I don't have to do treatments. And the doctor comes in and like, you have to do treatments, and you're like, the doctor was lying to me. Google said I didn't have to. It's like
But that's the only, like I read it from that perspective. Like if
that's
I
the
was,
only thing.
and we did ask to say what should I eat to manage my
Yeah.
IBD well, but it should point out this will help you manage in addition to other recommended therapies or treatments. Just so
Yeah,
that's the
because
only, if
that's the
we're
most
getting
important.
picky, that's the only thing that I feel like could be misunderstood. I don't think they did a bad job.
No.
I just think that a desperate parent or newly diagnosed patient is going to be like, I can manage my IBD with diet, and that's
And this is once again where it comes to Google AI, or just AI in general,
right.
making a human mistake, and where I feel like I could write it better, saying,
Right. We're being
like,
picky,
yeah, we're being
guys.
picky. But I feel like I would maybe word it like it could be treated with diet,
Mhm.
but it's different for everyone. And typically, for most people, it has to be treated with a diet and with treatments, both, not one or the other.
And sometimes never a diet.
And sometimes never a diet. You just have to
Right.
take treatments. But sometimes there's something you just can't eat.
Hmm.
And so you still have to be on a diet, but it's not going to help. It will just make you worse. So then you have to be on both
Right.
treatment and diet. I feel like it needed to be a little bit more specific,
Hmm.
but we didn't ask to be treatments
Right. We
and
didn't ask
yeah,
versus anything or
but
compared to. It's just kidding.
we just a little miss there.
Let's go to number three, which
All right.
can I, as an IBD patient, have my biologic drug in tablet form, avoiding subcutaneous or intravenous administration? So I'm sure
My honest reaction to that is like, oh,
yeah, I'm sure doctors do get asked this a lot because I know that's one of the things Mason was asking right away. Well, can I take a pill? Is this is like
and now I'm like,
no. And so, one of our questions was that is like, and a lot of people are like, well, why can't I? Why does it have to be this way? So let's see. So
I need to find
biologic is the key
dosage.
word here, guys. So any of you listening
Yeah,
say, oh, my child's on Revoke and there's a tablet, not a biologic.
not a biologic, but
So the question is, we
treatment.
asked ChatGPT was on a biologic drug. So what did
Yes.
they say?
So ChatGPT says, right now, most biologic drugs for IBD are still administered by subcutaneous injections or intravenous infusion.
Mhm.
So it says that's because biologics are large, complex protein molecules, antibodies or antibody fragments that would be broken down by your digestive system if taken orally, like any other protein.
Right. And we had asked that when we
That's
spoke
interesting.
at Soriso. Remember,
Hmm.
because we had talked to them about that. They, I believe, if you look them up, Soriso Pharmaceuticals is developing I think they're trying to develop a biologic that is in pill form.
That's
And
actually
so
cool.
it was interesting to hear because they said like so far most of them by the time like this just said ChatGPT was accurate on this. Your digestive system will break it down if it's taken
Yes.
orally. And that's the problem. They don't want it to break
No,
down
no,
like
because
this.
that then it's not going to be treating
Right.
effectively.
So the way it works, it's not effective when it goes through the digestive
Mhm.
system. So
So like Rinvoq, it's so
it's a JAK inhibitor.
it's a JAK inhibitor,
Hmm.
and it's not gonna treat things the same way a biologic does. So biologic can't be taken orally because
Right.
obviously it can't be
As of
broken
right
down.
now.
For now, yeah.
So Google AI, let's see what
See
they
what Google can
say.
do.
They say no. Most biologic drugs used to treat inflammatory bowel disease are not available in tablet form and are typically administered through subcutaneous injection or intravenous infusion. While some oral medications are used for IBD, they are generally not considered biologics. Accurate.
Yeah.
So I think again, both are excellent answers. And I took it. Google AI launches into the explanation of biologics and oral administration right after that. So
All right.
that's where it says biologics are large complex molecules that are typically proteins. When taken orally, they are broken down by the digestive system, rendering them ineffective as they cannot be absorbed into the bloodstream. I just want to include that because it took it a little bit further. I love these kind of answers anyways. You know me, this is like my stuff. So I'm always interested
Nice.
because it's like, well, why? And I think it's so important to understand the why and understand how these medications work, especially if your child's on them, research them,
Mm-hmm.
learn
You gotta
about it.
research.
It's important. If you're on them,
You should
I
know
want to
about it.
know.
Yeah, you should.
I mean, maybe some of you don't want to know
Yeah,
either.
maybe. Yeah, yeah. There's sometimes there's like I don't want to know how it
Right.
works.
I'm good. But I think that what is important here is what Google AI did well is they explain why they would be ineffective through the digestive system by saying they can't be absorbed by the bloodstream. They also explain they do have some oral medications that are used for IBD. So I like how they included that because some people reading the other one might be confused and say they get Rinvoq confused with a biologic. And so a lot of people may think there is an alternative. Both great answers again. Both seemed accurate. Both
Yeah,
were
both are
good.
good.
And then another question. I don't know if we have. Yeah, we do
Oh
have five.
boy,
I was
this
just
is
checking. I
why is
thought.
that? Why is this one so long?
Yeah, sorry.
Well, guess what? I get to read the short.
Question number four.
This says, do I, as an IBD patient, risk infection or cancer by doing biologic therapy?
So, and I wanted to say this was one I debated on taking out because I don't want to put misinformation out there about something that really is an important topic between you and your doctor. Again,
Yeah.
this is something that
That you need to consult with your doctor, not
really,
AI,
yeah.
not us,
It,
not Google.
so I did want to include this though because I think the answer was important because this is what they're putting out there. Again, this should not replace
No, do yes,
the doctor
please,
and
please
having that
consult your.
conversation and understanding why something is important. So again, but super important question. I think this is why a lot of people avoid biologics. So I do think it's important we talk about it. So I left it in there. Go ahead, Mace.
All right,
So
ChatGPT.
again, the question was, do I, as an IBD patient, risk infection or cancer by doing biologic therapy?
Yeah.
All right.
So we started off by saying yes. It says, but the degree depends on the type of biologic, your age, other meds like steroids, and overall immune status. Do biologics increase cancer risk? It says very slightly in specific contexts and much less than previously feared. The absolute risk is small. The risk of uncontrolled chronically active IBD itself increases colon cancer risk over time, so a well-controlled disease with biologics may actually lower your long-term cancer risk by preventing constant inflammation.
So
So,
there's more fear of the biologics when you should fear the disease more.
yeah.
And so I thought that was important. And this is a chat GPT response. And so I thought that was interesting. I also thought it was really good. It was encouraging to me. I thought that was a good response.
So yeah, so if you don't treat it, it increases colon cancer. If you do treat it, there's a very, very slight chance of
It can increase the
breast
risk for
cancer.
other cancers, but it can decrease the risk for that. And so, but like I
So it's
said,
actually help.
yes. And so I think it's an interesting answer, but again, important to discuss with your doctor because
Yes.
you have your own risks, your own age, and
Everyone is
other health.
different, and your doctor will know
There
best.
may be other health issues you may have too, besides Crohn's disease or besides ulcerative colitis. And Google AI, they answered, in conclusion, while biologic therapy carries potential risks of infection and cancer, these risks are generally considered manageable, and the benefits of controlling IBD often make it a worthwhile treatment option for appropriate patients. It's crucial to have a thorough discussion with your healthcare provider
Yes, there we
about the
go.
potential risks and benefits in your specific situation. And then it breaks it down. I'm not going to go through all these, but I just put this up here to remind myself to mention it. They talk about all the different ways you risk infection and the different types of cancers. And so you guys can look that up. ChatGPT also will list those. And I
Mhm.
don't, this is enough for another show to talk about those kind of things.
Yeah.
But again, important conversation. I like how Google AI mentioned to talk to your
Yeah, I
doctor.
like that too. I think maybe that's where ChatGPT needs to talk about that a little bit more.
Maybe mention, yeah,
But
yeah, I mean, that's the only thing I could really pick apart. I think they both did an excellent job. So I think that's what they both did an excellent job with is they answered that question very well.
mm,
So our fifth and final question for the end of the show is going to be,
right.
this is again, these were the ones that GI doctors said are asked the most. Will my IBD be
Okay.
transmitted to my children? This is a hard one to answer. So I was curious, what is
Yeah,
ChatGPT and what is
what are they
Google
gonna
AI?
say?
What are they going to say? Mason, I'll let you start it off with ChatGPT.
All right. So ChatGPT starts off with IBD, Crohn's disease, and ulcerative colitis is not directly transmitted like a simple genetic disease, but there is a clear genetic predisposition combined with environmental factors. And so then it has this little graph, I guess you'd call it.
Yeah, they put up a chart,
Yeah, so it's
which
a
I
little chart.
liked.
And so it says risk of children of IBD patients. So it says parent has IBD.
So there's a section. So the first one is what the parent has IBD. It lists the things, and then the
Yeah.
children's risk of developing IBD. If neither parent
Parent
has
has IBD.
IBD,
There's around a 0.3% chance of your kid getting IBD or general
right?
population
So less
risk.
than
Yeah. Less
1%,
than 1%.
0.3,
Yeah, around that.
very
That's
small
very,
if neither
very small.
parent. So that's our Mason. That's a
Yeah.
percentage
That I have.
Mason
See,
fell into.
yo, so the next one is one parent with IBD is around 5% to 10%. So that's
Right.
if one parent has IBD and it varies by studies. And
Mhm.
so, it's not a lot, but it's definitely increased from neither parent. And then both parents with IBD goes up to
35%.
35%, which is a rare scenario.
Right. It's rare that two people with
Yeah, it's
IBD
rare that
probably
two
are
are.
married. Yeah.
Yeah, but so that's a
See,
little bit more than a quarter, so
so they're proving what they said is a clear
10%.
genetic predisposition. There's I'm going to probably answer the question I think on the next one, but I know Mason's had genetic testing and there isn't always a genetic test. There's nothing that I know of that can determine that you have Crohn's disease. Looking at Mason's genetics,
Yeah.
nothing in there to indicate anything with
No,
this. It'd be interesting also to see because a lot of times when one sibling has it, another sibling gets it.
that's an
So
interesting
that
one.
does happen too. So you can see where the risk goes.
That's interesting.
Yeah. So Google AI said, while IBD itself is not directly inherited, there is a genetic component that increases the risk of developing IBD if a close family member has it. The risk is higher for first degree relatives, parents, siblings, children, and increases further if multiple family members are affected.
Okay.
So they have a little more broad answer, very similar. The other one, I like how ChatGPT broke it down.
Was more precise.
Right. Like
Okay, still good.
but Google AI was correct. Because it's interesting when there's not a genetic component to it. It's not, well, not that, but it's interesting when they say it's not directly inherited, but there's a genetic component. But we don't know what that gene is, and we don't know what that genetic is, but we can't track
That's what
it.
we're trying to
But
figure out.
so this is another part of the mystery of IBD.
Yeah, one of
So
many mysteries of IBD.
yeah. So that's it. That's our questions that we talked to ChatGPT and Google AI.
Yippee.
You know, I don't. It might have been. I hope it wasn't boring. I hope you guys learned a little bit, and also, you know, I was impressed. I could have kept going with this and kept asking more questions, and I think that for the most part, they did a good job.
Yeah, they did.
Yeah, for somebody who doesn't have this disease, and if you have a friend that has it, this might be a great tool
Might
for
be
you to
helpful
look
for you
up.
to
You
learn.
know, maybe you can ask ChatGPT, how can I help my friend?
Yeah, how
You
can I help
know,
my friend with IBD?
what are they going through?
Mhm.
So I think that if you don't have like, you know, we do these things, we talk about it as a podcast, but some people don't have somebody to talk to, or they don't feel comfortable asking. So I do think ChatGPT is helpful for those people who maybe need a little help coming up with what to talk to their doctor about and maybe just asking some questions to not feel so alone and hear stories or other situations. So I think it's kind of cool for that. And there,
Definitely.
yeah, but that's ChatGPT. You
And
can use it for whatever you
yeah, you can ask
how
ChatGPT if you should subscribe to us.
yeah, I know we've had a few new subscribers and
Oh yes.
new listeners, and we did have there was a cool comment last our last one.
How about
Yeah, and so it's always nice to hear from you guys and know that we're helping and we're providing some information that's beneficial to you
Yeah,
guys.
we love to know that we're helping.
Yeah, and so hopefully ChatGPT, maybe this is new to you, maybe you've heard about it, maybe you use it. So it's, you know, good to talk about, and it won't be the last time we talk about it.
No,
And so,
it's
but
definitely the
good to
future.
good to start. So yeah, you guys can follow us on Instagram at Team IB Determined.
Yep.
You can also follow the Reggie Project, and we're, you know, we have Karmatude candles. We don't always talk about it, but it you can order them on karmatudecandles.com. You can go to our website, and those help support the Crohn's and Colitis Foundation. And they're also a lot of fun.
And they
They're
smell good. Yes,
yeah,
we actually have one burning right.
yeah. So yeah, so that no, but it's an amazing that warmer's great. So we always have our candle
Mhm.
going, and like we pick a different one and put it in there, and it's fun. So, anyways, Karma Jude Candles, and you can follow that on Instagram as well. You guys can listen to us on any podcast station, Spotify, iHeartRadio, Amazon Music, Apple Podcasts, anywhere you listen to your
And there's
podcast.
more link to Buzzsprout.
Yeah.
But if if you're already listening to it on a podcast, I assume you're already
You
listening
found one
to
you
this, and you
like.
found one that you're
Yeah.
good with.
But maybe you're watching us on YouTube.
Yeah.
You're like, you know,
find a
I
podcast.
want to find a podcast station, or so that's
Yeah,
really
yeah. If you're
cool.
watching us on YouTube and you're sick of seeing us, you know.
Yeah, well, we record
Yeah.
all of our podcasts because I know some people do like to watch.
Yes.
We do these on YouTube also.
Yeah, and if you are on YouTube, there's also YouTube Short. No, not YouTube Shorts.
Yeah.
We have done some. But there's also the YouTube podcasts, which are not so new anymore, but they're still sort of new.
Yeah.
Yeah, and if you are on YouTube, make sure to like and subscribe. And if you want to be notified every time we post a new video, make sure to hit that bell icon. And please leave comments because we love getting comments as long as they're nice.
Yeah.
Yeah. You know how YouTube is sometimes.
Maze is like, we're not gonna listen to you otherwise.
Yeah, we're not going to do it. It's like, you're
Rude.
going to delete your post.
So, you know, and we hope that you guys are doing well. Mason
Yeah.
is halfway through his summer school class. And so that's exciting.
Yeah, it is.
And we're almost there, almost to 4th of July over here. So,
4th of July is
yeah.
almost here.
So hope you guys are all having a good summer. Well, depending when you're listening to us.
Just
And
be responsible with fireworks.
yeah,
Yeah.
hope you guys have a good rest of your day,
Yeah.
evening, morning, work week, anything. Hope it's good.
Have a great summer class if you're doing a summer
Yeah,
class.
for like Mason, you're taking summer
A great
classes.
summer break. Have fun reading Harry Potter. I don't know.
Yeah,
Have a
or
good
Hamlet is
4th
your
of July dinner. I don't know. You're having hot dogs or hamburgers. I don't know what you're doing. But yeah, just have a great time.
yeah. And we will see you guys. We'll be back in 2 weeks
In two
with the
weeks.
next
Yeah.
episode. So we'll see you then.
Peace.
Bye.
Bye. We hope you will stick around, tune in, and reach out to us with your own journeys. We are excited to give you an inside view of what it takes to be a caregiver and what it's like to be a patient.
And most of all, we hope you'll maybe be able to apply something you hear on here that might help you in your own life. Sometimes life changes, and it's all about how you handle the journey.